Alright guys, so this is just going to be a quick review of the study guide for Exam 2. Now, Exam 2 is going to cover the lectures on intelligence and intelligence testing, types of learners, and then standardized tests as well. So Exam 2 is going to have a very similar format to Exam 1, so there'll be multiple choice, true, false, and matching questions. There'll also be those two opinion questions that everyone will get the points for either when they initially take it, or I'll add those points in later. And as always, you can let me know if you have questions about anything. I am just going to be touching on some of the high points here, but if you have specific questions, please feel free to email me. So we started off with a lecture on intelligence, and we said that intelligence is something that needs to be a flexible, fluid definition, because what we really see as intelligent is something that changes over different time periods. So I use the example of technology being something that's very important during this time period, but in the past, things like being able to hunt and gather and to protect yourself from wild animals might have been much more important than being able to type, obviously. So when we're talking about intelligence, we're talking about being able to solve problems and adapt to your environment and be successful in whatever your environment is. So we talked about how it is important for us to understand a definition of intelligence in order to be able to design intelligence tests that measure the most important components of intelligence. So we talked specifically about the Wechsler test. So the WACE is the version for adults, the WISC is the version for kids. And both of those, the WACE and the WISC, will cover verbal comprehension, processing speed, working memory, and then perceptual reasoning or spatial reasoning. And so with each one of those, you get an area, you have a score in each area, and then your overall IQ score is made up of your score in each one of those 4 areas. Now, we talked about how we have a range of scores, and so once we have your overall composite IQ score, then we're going to look to see what range you are in. Now, technically, any score between 90 and 109 is in the average range. However, 100 is the exact mathematical average for a Wechsler test. So if a person were to make 100 on the Wechsler test, we would say you are exactly where we would expect. Remember, you're being compared with your same age peers here. But then there are also ranges above and below average for people who might be doing a little bit above or a little bit below average. And the reason we need ranges is because your score is not exact. It's more of an approximation, because there may be times when, because of your environment, because of stress, because of you have a headache or you're hungry or you're tired or whatever, that can impact your score. So we talked about how IQ tests are standardized, and we had more discussion of standardized testing in a different lecture, but generally speaking, this means that everyone gets the same questions, the same administration, and the same scoring, and then the number of questions that you answer correctly is compared with your same age peers in order to determine your IQ score. So it really wouldn't be fair to compare a 6-year-old's performance with a 10-year-old, for example, and it wouldn't really be fair to compare a 40-year-old's performance with a 60-year-old's performance. So we compare you to your same age peers. We talked about the Flynn effect, about how IQ scores are going up over time. And perhaps this is because we truly are more intelligent, but it's also possible that we have more test-taking experience, and so we have more test-taking skills. It could be because we have more access to information, so things like the internet, things like libraries, books are a little bit easier to access, that kind of thing. But because of the fact that IQ scores do fluctuate over time, and specific to the Flynn effect, they go up over time, this does mean we have to redo our IQ test every few years just to make sure that they are still valid and reliable. So speaking about validity and reliability, reliability refers to consistency. So with an IQ test, intelligence is a fairly stable concept, so you would expect your results to be reliable. If you made a 90 1 month and then took it again the next month, you would expect to be somewhere around a 90. Now, it might be a little bit higher, a little bit lower, depending on the variables we've already talked about. but you shouldn't be more than a few points off from where you were before. On the other hand, if you made a 90 one month and you take it again the next month and make 130, clearly something is going on. So we need our tests to be reliable, but reliability is not enough because your result could be reliably wrong. So in addition to reliability, we also need validity. Validity generally speaking, refers to accurately measuring what you're supposed to be measuring. So your intelligence test is valid if it is measuring all the important components of intelligence and not including things that are not important components of intelligence. Now, it is possible for an IQ test to be reliable but not valid. It could be reliably wrong. When we're talking about something that's stable, like intelligence, it's not really possible for it to be valid without being reliable. However, if you're measuring something that fluctuates, like for example mood, then your results could be valid without being reliable. You feel really happy on Friday, you feel miserable on Tuesday. That's not reliable, but it could be valid because your mood is something that does change over time. All right, theories of intelligence. We talked about how we have a general definition of intelligence, but different theorists have had different ideas about what intelligence actually looks like and then therefore how we should test for intelligence. So Sternberg suggested that we might have an analytical intelligence, a practical intelligence, and a creative intelligence. So analytical intelligence would be that logical analysis, probably someone who would do well with critical thinking, probably someone who would be successful in the classroom. But just because a person has analytical intelligence does not mean they can actually hands-on do something with that information or be creative and come up with novel ways of solving problems. Those would be the other types of intelligence. So someone might have more of a practical intelligence where they do better in real-world situations, hands-on things. Someone might have a more creative intelligence where they are able to think outside of the box, maybe to come up with novel or new ideas and solutions that no one's ever thought of before. Now, if we're thinking realistically about this, most of our measures when we're talking about testing in a classroom or when we're talking about something like intelligence testing, most of that would benefit the person who has an analytical style of intelligence because creativity is not something that's easily graded or easily scored. Gardner took this a little bit further and said, forget 3 types of intelligence, there are actually 8 types of intelligence. So Gardner would believe that there were 8 main types of intelligence and that no one person is going to be high on all of those, but maybe there are a few of those that you're high on. So he had things like verbal skills and mathematical skills and bodily kinesthetic and naturalist and intrapersonal and interpersonal music, all these things. And he would say that some individuals are high on some and some individuals are low on others. Now, he also wanted to include a moral intelligence, but was not able to find research support for that. So that did not end up being included. And then we touched on nature versus nurture with intelligence. There is some evidence to support both. So on the nature side of things, sometimes children show high levels of intelligence at a very early age. Maybe they meet their milestones very early. They're very early readers. They have very wide vocabularies, that kind of thing. Or maybe they're gifted in things like building or drawing, music, whatever. But when that happens at a very early age, before the child has begun formal education, then that suggests a genetic component. So no one taught this to the child. So it's not the environment, so maybe it's something they were given genetically. On the other hand, nurture refers to your environment, so there is also evidence to suggest that environment is related to intelligence. If you need evidence for this, just look at intellectual disability. Sometimes a more mild intellectual disability is diagnosed when a person has not received adequate different enrichment opportunities, having parents read to them, or being involved in educational activities from a young age. So because of that, we know that your nurture can hinder you or your nurture could help you. And one of the things that seems to point to this is that people are usually gifted in areas that they have practiced for quite some time. So a person is gifted in music, well, maybe they had a genetic predisposition to be gifted in music, but without the nurture of having the instrument available, having lessons and practicing, then they probably would not be very successful. So as always, it's a combination of both, but there may be some situations where a particular health issue might cause nature to be more important, or a particular environmental issue might cause nurture to be more important. Good. So then we talked about different types of learners. We briefly touched on reflective versus impulsive thinking, which referred to students that either take their time and work through the problem to make sure that they are accurately producing what the teacher wants, or students who kind of blurt out or write down the first thing that comes to mind without putting in as much effort. Now, this is not to say that the impulsive thinker is not intelligent. They may be very intelligent, but maybe they were lacking in some self-control or some attention span here to be able to really meet their full potential. We also talked about deep versus surface learners. So deep learners are those that, in addition to listening to the information, they also find a way to make it personally relevant to them. So they think of their own examples. They go out in the real world and practice what they're learning. So because of the extra effort they put in, they're more likely to retain this information and be successful with it. On the other hand, surface learners are the kinds of learners that just memorize the information to be able to maybe be successful on a test, and then once that's over, completely forget about it and don't use it anymore. Now, unfortunately, I feel like we might have created some of this. Maybe we've reinforced surface learning with the way that we conduct our classrooms, and with the fact that oftentimes that's the most successful way to go. You want to make a good grade on a test, so cram it in as much as you can, and then once you're done with it, you're done with it. So unfortunately, I feel like we might have set this up a little bit. All right. And then we started off with our types of learners, talking about learners that had additional challenges to overcome. So I would like for you to be able to recognize some of these things, and then also have a little bit of an idea about accommodations we can make. There's going to be a lot of overlap between the accommodations for several of these. Things like individualized learning, staying in the zone of proximal development, allowing the learners to do hands-on projects, to move around, to not have to sit in a desk all day. Those kinds of things are helpful for all students, gifted students, students with extra challenges, or typical students if such a thing exists. All right, but briefly touching on these, someone who has a learning disability is someone who has typical intelligence, or maybe even above average intelligence, but their performance in a particular area is not lining up with their intelligence. So to make a diagnosis, you compare achievement testing in a particular area with intelligence testing. And if intelligence is fine, and yet we're struggling with achievement in math, for example, then that might be a situation where a person has a math disorder. So a specific learning disorder with impairment in math. Now, something that's important with all of these is to have appropriate expectations because of something like a self-fulfilling prophecy. A self-fulfilling prophecy happens when you believe something is true, so you behave in ways that make it become true. And this could actually work out well for you or not so well for you depending on the situation. So if a teacher believes that students with learning disabilities cannot learn, then that teacher will not put in the time and the effort to help that student, and therefore the student will not learn, which then, according to the teacher, would then verify what he or she thought they already knew. When it comes to learning disabilities, children can be successful in the area they're struggling with, but they're going to need extra tutoring, they're going to need extra practice, they need perhaps more hands-on things, concrete things, test-taking accommodations, so extra time, quiet place to take a test, that kind of thing, but can be successful. All right, ADHD, attention deficit hyperactivity disorder, so we had a note on the appropriate language to use here. So ADHD is the correct term, and then you would have a certain presentation. So you would have ADHD with a primarily inattentive presentation if you have a student who has attention issues without the hyperactivity. Or you could have a student who has ADHD with the hyperactive or impulsive presentation if the person does not have as many attention issues but they have more hyperactivity. Or you could have ADHD combined presentation if the student has problems with both hyperactivity and inattention. Now, we said that ADHD is something that usually shows up during early childhood, and that it's not always diagnosed in early childhood, though. So even if we are assessing an adult for ADHD, we're still going to ask, when did these symptoms start? Was school hard for you? We're going to try to get at whether these symptoms have continued from childhood. Now, just like as I said with a learning disability, having appropriate expectations is important, and the student may need test-taking accommodations as well. Especially helpful here would be a quiet, distraction-free environment. But in addition to that, when you're working with students who have ADHD, things like simplifying the instructions, things like repeating the instructions as much as possible, reinforcing a lot. So we're going to talk more about this with behavior modification, but reinforcing the individual for completing each step would be really helpful. All right. Intellectual disability refers to a person who has an intelligence test score of about 70 or below, and then in addition to that has problems with adaptive functioning. So that just means that the person's not able to function in day-to-day life. That could be problems in a classroom, could be relationship problems, work problems, could be self-care issues, that kind of thing. So intellectual disability is something that we would expect to see in a person before the age of 18, and is probably noticed before then, but the more severe the symptoms, the earlier the diagnosis likely will happen. So there is a spectrum here where some individuals might have a more mild form, all the way down to individuals that may have a very profound form of intellectual disability. The more profound forms, where the more severe symptoms, are almost always genetic in nature, at least primarily. So things like Down syndrome and other genetic conditions, or conditions potentially that happened at birth. So if there's an unfortunate birth situation where a child was deprived of oxygen during birth, that kind of thing, then that could potentially be the issue. If we're talking about a milder form, this could be something genetic, but it could also be something environmental, just not getting enough educational opportunities. So one thing I did mention here, fetal alcohol syndrome being the most common preventable form of intellectual disability, and talking about how because we're not able to do this research in an experimental way for obvious ethical reasons, the safest course of action and the correct course of action is to abstain from alcohol during pregnancy and breastfeeding as well. All right, we touched on physical disorders a little bit, students that might have orthopedic issues, maybe a wheelchair situation, or students who might have seizure disorders. So when we're talking about students with any kind of medical condition, making sure that you know what to do if an emergency arises. If a student does have a seizure in the classroom, what are you expected to do? Who do you contact? What medication might you give the child? So having all that information. You might also think about allergies. So if a child has a severe peanut allergy, then that might be something they come in contact with in the classroom, that kind of thing. So you need to know about medications, you need to know about the child's history, and so you would talk with parents, you would talk with supervisors, other people who have had those students. We also might have students who have sensory disorders, so we talked specifically about students who have visual impairments or students who have hearing impairments. So there may be some students whose sensory problems are significant, but they still have enough use of their vision or their hearing to be able to, with some accommodations, use them in the classroom. And there may be some individuals that do not have enough vision or hearing to be able to use them in the classroom, so they would require additional accommodations. Now, it would be difficult depending on the amount of resources that you have and the class size that you have, but once again, working with parents, working with supervisors, working with other teachers that have had this student and might be able to give you some tips would be great. Autism spectrum disorder is a developmental disorder that we typically see very early on, usually before the age of 3. The symptoms are there, although they may not be diagnosed at that point, but the symptoms are there. The main symptoms involve social issues, so a lack of social reciprocity, eye contact, a knowledge of social cues, social norms. In addition to that, communication difficulties are common, as well as some specific repetitive interests, so maybe only interested in a few things and get extremely attached to those few things that they are interested in. Now, we talked about how previously we had a diagnosis of Asperger's disorder, but that in the DSM-5, the latest version of the DSM, they have combined autistic disorder and Asperger's syndrome together. So someone who previously would have been diagnosed with Asperger's syndrome would now be diagnosed probably autism spectrum disorder mild. So we would have mild, moderate, or severe. We also talked about emotional and behavioral disorders, so things like depression and anxiety can come up in the classroom. You may not be the one providing the behavioral treatments that are needed, but you may be the one that recognizes it and refers the student to the person who provides the treatment. If you are interested in being a school counselor or working with kids that have emotional problems, then you probably would be the one providing that, and you would be taking other classes that would train you in the details. So things like abnormal psychology, and you'd probably go to graduate school to get the training you need to be able to give those treatments. But behavioral treatments are especially helpful with children. As far as behavioral disorders go, we talked about how students might have emotional problems as the underlying cause, but the obvious symptoms might be more behavioral in nature, and that this happens more in male students and also more in low socioeconomic students, perhaps because of like a stressful environment, that kind of thing. We talked about how we have legislation that attempts to make sure that our public schools are giving each student the best possible education. A couple of major points from that would be an IEP and an LRE. So the IEP refers to an individualized education plan, where after an assessment, we look at the results of that and come together with a team to determine what resources the school can provide to help that student be as successful as possible. Part of that plan would probably have to do with the environment in which the student is going to be educated. A least restrictive environment refers to the idea that if a student can be successful in, like, for example, a regular classroom setting, that's where they should be, that we should only impose restrictions on the student's setting that are helpful to the student and not for any other reason. All right. And we talked about gifted students. So we did mention that students who are gifted typically are gifted in particular areas, not gifted in all areas. So once again, having reasonable expectations. We talked about the nature versus nurture, which kind of goes back to nature versus nurture in intelligence. When you're working with gifted students, part of this does depend on your ability to provide extra enrichment opportunities, and those resources may not always be available, but things like advanced placement classes or gifted classes, or perhaps things like work programs, mentorship, that kind of thing. In a regular classroom, a teacher might give extra assignments, extra opportunities. We did talk a little bit about the pros and cons of having gifted students kind of tutoring classmates that are a little bit behind. We also talked about specifically splitting students up in a classroom based on their ability level. And we talked about how this might allow for keeping a student in their zone of proximal development, but this could also create a self-fulfilling prophecy. So it's something that if we were going to use this, we would want to use it some of the time, but not all of the time. All right. And then we talked about standardized tests. These are tests that have standard questions and administration and scoring procedures and interpretations, so that theoretically then this allows us to compare students to their same age peers. We do this to hold students accountable, to hold school systems accountable, to make decisions about classroom placement, scholarships, that kind of thing, and then also to evaluate our programs to see if maybe our particular gifted program is helping or our reading program is helping, that kind of thing. Now, we talked about standards-based tests. Basically, this is a situation where we have determined what we think the average student of that particular age should be doing. And so when you take the test, your score is going to be compared with a standard, and then you would either meet that standard, maybe exceed that standard, or maybe fall short of that standard. Now, we said that we could do this without it being high-stakes testing, but oftentimes these two are combined. High-stakes testing refers to using the results of a standardized test to make important decisions for a particular student. All right, we talked about different types of reliability and validity. When we're talking about your normative group, we're talking about designing a test and then giving that test to a wide variety of individuals, as large a sample size as you can get, that should be diverse and should include representation for all different types of individuals that may be taking that test. And because of that, once you do that, then you can say, well, the results really are fair. But if there's a particular group of people that were not included in the normative group, then it's not really fair to give those people that test later and make that comparison. Validity in general refers to the accuracy of your test, and so we talked about things like content validity, making sure that you've covered all of the important areas and haven't included any other areas in your test of whatever it is that you're measuring. But we also talked about things like concurrent validity. So is this accurate based on other measures we have right now? Like, for example, does this make sense compared to like your classroom performance? As well as predictive validity. Do these results make sense in light of how a student goes on to do later? So some things like the ACT, GRE are intended to be predictive of future performance. They're far from perfect, but that's what they're intended to do. On the other hand, reliability refers to consistency. We talked about things like split half reliability, so checking to see if students did about the same on one half of the test as they did on the other half. We talked about like test-retest reliability, where you give a test one day, you give the same test to the same students again at another time, and then compare the test scores. And then alternate forms reliability, where if I'm a teacher and I'm concerned about cheating, then maybe I make multiple forms of the same test and administer those, and then you would look to see if students were fairly consistent on version A and version B. There are other types of reliability and validity, but those are the only ones that we're going to focus on. We talked about aptitude versus achievement test. Aptitude tests measure your potential to learn, so something like an intelligence test would go in this category, whereas an achievement test measures something that you have already been taught. So this could be an achievement test that you use in an assessment to look for something like a learning disability, or it could be something in a classroom setting. So when you take a math test after learning a new concept, you're being tested on the material you have been taught. So that's based on your achievement. All right. I feel like you guys are fairly well versed, at least in the cons, but I think also in the pros of the state standards-based tests. The idea is that we do need to hold students accountable. We do need to hold teachers accountable. How would we know if a school district was not doing its job if we didn't have standards-based tests? On the other hand, of course, because teachers feel pressure with this, then they're likely to start teaching to the test, kind of dumbing down the material, focusing more on a multiple choice test format, not including other kinds of writing and other things like that. And then also you may feel like you can only cover the specific topics that are going to be on the standards-based tests. So how do we improve our test-taking skills? Well, encouraging students to keep track of time so that they don't spend all of their time on difficult questions and end up leaving easy questions blank. Go through and answer the easier questions first, and then go back and take some time at that point to try to figure out the more difficult questions. Be aware of the time. Don't ever leave a question blank, especially not on a multiple choice test, but at the very, even on an essay test, just guess, do your best. You might at least get partial credit for it. Having students try to calm down. Sometimes if you have students who have test anxiety, this may be something that goes back to behavioral therapy, but things like deep breathing, and talking with someone else who's already experienced this. I know that I have students come to me anxious about the GRE all the time. I think it's helpful for students to know that they're not the only ones who have ever had issues with test anxiety. And then when communicating those test results to parents, you want to make sure that you include other information as well, not just the standards-based test. And you also want to tell them that these scores are approximate because they really truly are just approximations. Percentile ranks might be easy to understand. Keep in mind that some parents will have more experience or less experience with standards-based tests, so percentile ranks may be something that's easy to talk about. And then be prepared to answer questions. Try to encourage parents to ask questions so that you're actually having a discussion with them, not just talking at them. All right. This has just been a quick review of the study guide for Exam 2. If you have any questions, let me know. Otherwise, I will be talking to you guys after Exam 2 when we start the material for Exam 3. So I'll talk to you guys then.